Hello, my name is Rachel Tilley, and today I'm going to be talking about vitamin B12 and the elderly. Here's some background information involving the elderly. Someone who is considered to be elderly is someone who is the age 65 and older, according to OECD. As we know, B12 is a water-soluble vitamin. It's very important in the development of nerves and the nervous system, as well as making red blood cells. This is all according to medical news today. B12 deficiency can lead to a number of symptoms. This can include headaches, trouble focusing, memory problems, tiredness, confusion, mood changes, and more. If you are B12 deficient for a long period of time, it can cause long-term neurological problems. B12 is found in a number of foods, such as beef, pork, ham, poultry, lamb, certain fish, and dairy products. Due to B12 being found in a number of animal products, vegetarians are at high risk for deficiency, and so are older adults, such as the elderly. Here is an article I found on PubMed titled Vitamin B12 Deficiency in Elderly Patients. Basically, this quote I pulled from the article is saying that B12 deficiency occurs among elderly people, but is often unrecognized because the clinical manifestations are subtle. They are also potentially serious, partially from a neuropsychiatric and hematological perspective. Causes of the deficiency include most frequently food cobalamin malabsorption syndrome, which is above 60% of all cases, pernicious anemia, which is 15 to 20% of all cases, and insufficient dietary intake and malabsorption. This information is also pulled from the same article as mentioned in the previous slide. There is two ways to define a B12 deficiency. One is a serum B12 level of less than 150 picomoles per liter for two separate tests on two different occasions, or serum B12 levels less than 150 picomole per liter and a total of homocysteine level greater than 13 micromoles per liter, or methylmalonic acid greater than 0.4 micromole per liter. Now that we have covered the diagnosis to being B12 deficient, now we're going to talk about how to treat this deficiency in the elderly. According to Better Health While Aging, there's two different ways it can be treated. You could take supplements about 1,000 to 2,000 micrograms per day, or you can get a shot that is intramuscular that is 1,000 micrograms of the vitamin. This will help treat deficiency issues throughout your aging process. As we all know, there's nothing you can do to stop aging, but you can practice a healthy lifestyle that will prolong the effects of aging. Physical exercise, healthy diet, adequate sleep, and more can all prolong the effects of aging. It's important that the population is well educated at what they become of higher risk to when they reach 65 years old. Being informed is a number one priority to reduce a B12 deficiency. If you are an elderly, I would recommend to get your B12 levels measured at least once a year to make sure a deficiency problem does not get out of hand. Maybe even start taking a supplement if you already know you are at risk for developing a deficiency.